Hey guys.
Hi.
Hello.
Hi everyone. Happy Sunday.
Yay. Hey guys. Well, I am here with two of my friends, Nicole and Jen, and we are going to be talking about lasers and peels. I have some questions that you guys posted on the picture as well as some DMs that you guys sent me directly. So we're going to answer questions, just kind of talk about, I don't know, some basics, and just feel free to ask questions and we will try to keep up with them as we go. So, why don't you introduce yourself, Nicole?
Okay, sure. So, hi everyone. My name is Nicole and I am friends with Jen and Amber. And most of you probably haven't seen me before, but I've been in the aesthetics industry for a long time, more than 12 years. And when I started off as a licensed esthetician, and I was really building up my business specifically with chemical peels, and it's something that I became really passionate about. So I actually started working as a trainer where I traveled all around the world to educate on chemical peels and how to treat patients and get good patient outcomes and everything in between. So I'm here today to talk to you guys just about any questions that you have and how to get good results with your chemical peels. Most recently, I was the Vice President of Global Education for SkinCeuticals, and you know that SkinC has some amazing chemical peels, so I'd love to talk about that today. And now I'm here. I am the co-founder of Aesthetic Influencer. It's a social media management agency for doctors in the world of aesthetics, where we help doctors who do chemical peels get out there and talk about what's great about them. So if you have any questions, please don't hesitate to reach out to us. We'd be happy to answer them for you. And here it is.
And Jen.
Hi everyone, I'm Jen Hickman. I'm a nurse practitioner in dermatology. I've been in dermatology for about 12 years as well. And I've known Amber for a really long time, and I've recently met Nicole, and this is us.
And you want to give a disclaimer?
Oh, yeah, that disclaimer. Oh, yeah. You'll notice I'm the farthest one away from the camera. I'm like, disclaimer. I did some microneedling yesterday, so I don't look as scary as I did yesterday, but I'm a little red, a little pink, a little rosy. So that's why you'll see me farthest back.
You look fantastic.
Awesome. So I thought we would start with peels, and I know one of the questions that we got was pores, so I did remember that in my mind. So what really differs from peels that you would do at home versus in an office?
Okay, so there's so much information out there about chemical peels, and one of the things that is very different than a peel you might use at home versus in office is the pH of this specific acid. There's so many different acids, and there's so many different depths of chemical peel, and we'll talk about all of that and how to choose the right treatment for you. But typically, the treatments that you get at home are buffered, so it might have a specific percentage of glycolic acid or lactic acid, but they'll put something in it as kind of like a safety net so that when you use it at home, the risk of you harming your skin is going to be significantly less. So you might be thinking you have maybe a high efficacy peel in your hands, but a 30% glycolic acid peel with kind of like a buffering agent inside or a neutralizing agent inside, you might be getting only 10 or 12% glycolic acid at home. So that's why we actually always encourage you to go into an office, because the professional peels are very different. They're pure concentrations, they're pure acids, they aren't usually buffered, and your professional is really highly trained, so they can use those peels. They know how long to leave them on your skin, how to prep your skin, and for you to get the results that you're looking for.
So that's where the neutralizing agent that they use afterwards comes in.
Definitely.
Okay.
Definitely. Yeah.
Now, what are some of your favorite acids that you have used?
Okay, so estheticians, physicians, nurse practitioners, we all have our favorite things. What's good about chemical peels is that they are very versatile. There's a peel for everyone. There's a peel for every skin condition that's out there. Repeat your question. Sorry.
What are some of your favorite types of peels?
So, honestly, I prefer the superficial peels. Even though I have access to everything, I have access to peels that go very, very deep in skin, such as a TCA. I have access to Jesner peel, which goes medium depth in skin. I actually prefer the superficial peels like glycolic acid, like lactic acid, because you can control them a lot easier. And they do so many great things for skin, and you can get fantastic results with a superficial peel without having to really go through a lot of downtime. So you may need a few more treatments with these types of acids, but you always will get a fantastic outcome. It's much safer, and there's a lot less downtime.
Now, I know a question that we had is, should it always sting?
Yeah. Anytime you have an acid on your face, it's going to sting. And that's actually a good thing. We say that if it's tingling and stinging a little bit, it is working. The natural pH of your skin ranges from about like 4.5 to 5.5. So your skin is naturally acidic. And anytime you really want to cause rejuvenation, you kind of have to take the skin outside of that pH range. And that's why we have acids that have very low pHs. Like sometimes you will see glycolic acid peels with a pH of like a 0.6. And just as a reference, your stomach acid has a pH of 2. So some of these peels are more acidic than the acid in your stomach. So it just depends on, really what you're going for. But anytime you take the skin outside of its pH range, either below or above, it is going to sting and tingle a little bit. But as long as it's controlled, that's a really good sign.
Awesome. So I know that one of the questions that we had was about pores.
Mm-hmm.
So other than, can peels address pore size?
So unfortunately, there's not too much out there that can really change the size of your pores. But peels can be used to help make them appear smaller, and it works by doing a few different things. So usually sal acid peels or beta hydroxy acid peels are fantastic for managing pores because you clean up the oil that's inside of the pores. So whenever you reduce the oil inside of pores, the pores shrink a little bit. Also, whenever you remove excess keratin or excess skin cells out of the pore, they also look a bit better. So when your skin is well exfoliated and we use peels, you get a lot of fresh collagen production in skin. The appearance of your pores actually will get a lot better.
I love collagen.
Me too.
I know.
So what are some of the skin conditions that a peel can address?
So peels are amazing because you can address almost everything. We've got peels out there for acne. They're fantastic for acne. They're good for photo damage. They're good for fine lines and wrinkles. If you've got melasma, we have peels to address that. There are even peels now that can deal with rosacea, AKs, different things. So anything that you've got in terms of skin conditions that concern you, there's usually an acid for. And peels are so great because you can integrate them into any other treatment that you're doing. So if you have significant photo damage and you see someone like Jen for IPL or laser, you can integrate a series of peels in between because they'll help maintain those results and keep your skin really healthy in between those treatments. So if you have any issue with your skin, go see your esthetician, go see your doctor, because they've got a peel that's right for you.
So we have a lot of questions. Selfishly, you mentioned rosacea, so I'm kind of a little bit interested. I know a couple people have messaged me about that, so I'm interested in that. And then peels for melasma, and then neck peels.
Okay.
Or do you treat the neck as the same as the face and just take it all the way down?
It depends. It definitely depends. The skin on the neck is much thinner than the skin on the face, so you have to really treat it a bit differently, and I've seen peels go really, really wrong in the neck, so we'll talk about that. So specifically for the neck, you want to do lighter acids for less time. So if I'm doing like a glycolic acid peel, 20% on your face, that's something I could put on the neck, but I might leave it on for half the time that I would leave the acid on your face.
Okay.
So that's something you can do. Whenever there's a deeper peel that you're considering, if you've got significant damage on your neck and your décolleté, you really want to go to a physician who's been very well trained on peels and try to ask for treatments that don't go very deep onto that skin, because you do run a risk of scars and burns. So you have to be very careful there. But there's other treatments for your neck too. So you can have IPL on your neck, you can have IPL on your décolleté, and use the acids on your face. And if you've got issues on your facial skin that you feel really need aggressive treatments, you can stick to the acids for your face and then use lighter treatments for your neck.
I like that you mentioned kind of big picture and talking about some of the treatments that Jen does as well. Now, what about melasma?
Okay, melasma is very tricky. There's a lot of peels out there that can do well for melasma. And everybody that you ask will probably have a different answer on this, but one of my particular favorites for melasma is a Jesner peel.
Okay.
Jesner peels come in different strengths. I like a good medium strength Jesner peel to go in a few layers. And the reason is because Jesner peels are fantastic for pigment. And when you're managing pigment, especially with melasma, you have to consider a few things. Melasma is hormonal, so there's always that hormonal trigger to pigment. And because you have active triggers in your skin, anytime you add heat or inflammation, those triggers get worse. So you have these cells creating pigment, and they're putting color in your cells, but then you have to exfoliate those cells away. So you have to manage melasma in many different ways, and it comes with really good home care as well. But with a Jesner peel, we actually can do a lot of this without causing too much inflammation, and we can get rid of a lot of that patchy pigment that can be really bothersome to people who do experience that.
Okay. So were you referring to the Jesner peel? How to spell that? If that's the case, it's Jessner. Now, kind of going back and forth now, and you deal with melasma as well,
Yes.
Jen.
Yes.
Mm-hmm.
So with lasers, what are kind of the do's and don'ts? Can you do IPL with melasma?
You do not want to do IPL with melasma. So if anyone tells you they can get rid of your sunspots, that kind of get darker around your time of the month or when you're out in the sun more often, don't do that because it will not help your IPL. It will not help your melasma. One thing that you can use for melasma is Fraxel. Now, Fraxel can work for melasma, it can work for fine lines and wrinkles, acne scarring, and when you're doing it for those other two things, your face it's very, very hot. It's, you're just like, you walk out of the office like a red tomato. But when it comes to Fraxel for melasma, we decrease the settings so it is not that hot, but it will still help with the pigmentation of the melasma. So, make sure you don't do IPL for melasma. I've had people come in that they've had it done, and I'm like, oh, okay. And, coming at it from different modalities, it's something that's going to be with you. We can't cure it. It's a condition that we chronically treat. So doing different things, at all different times are ways to help really control it.
I was going to ask you, what does a long-term treatment plan for melasma look like for one of your patients?
For one of my patients, a long-term treatment plan would be topicals, various hydroquinone-type topical medications. Those medications, again, you're on for a few months, off for a few months. On the off months, maybe even doing non-hydroquinone-type bleaching or correcting cream, doing peels, and doing Fraxel. I mean, it's all about a patient's budget and, what and their activities, If you are someone who's outdoors a lot, during the summer especially, you're going to have, it's probably going to be more prominent at that time. So it's going to be dependent upon the patient and, obviously their financial situation and how they want to go about it. But they should always be doing something, whether it be topicals, a peel every now and again, some Fraxel here and there, to help maintain it, and then also stressing sunscreen every day.
Absolutely,
Very
sunscreen.
important.
Yeah.
Definitely.
So one of the things that I just kind of wanted to highlight myself, and being a patient of Jen's, is kind of the importance of, I know that someone had mentioned, how to find qualified providers, in my interactions with Jen, with just how in-depth she gets with the consult, with, tell me all about your health history. I mean, some of the questions that you think are just like, why on earth are they asking this? I mean, it's relevant information to kind of, you're weeding out, these procedures may not work, this might work better, and so it all kind of, makes sense. But one of the questions that I saw pop up here, and then I had asked on the picture was, how do you find qualified providers, whether it be an esthetician or dermatologist?
That's the question of the hour.
It's a great question. Okay. Well, and it's hard to say. I mean, if someone is asking me, how do I find a qualified provider for derm in general, going to the American Academy of Dermatology and finding a board-certified dermatologist, and within their practice, there are mid-levels, nurse practitioners that, are also on board, but, reading the reviews, like reading about them, do they have something social media, finding out about them, and then, trying, it's not going to hurt someone's feelings to go into somebody and you do consults, whatever, and it doesn't click, you don't jive with the person, then you need to go back and do your research and see if you can find somebody else.
It's so true. I get asked this question a lot, especially when I was traveling very frequently. People would always ask me, how do I know? Because the training is not the same. It's not the same for estheticians. It's not the same for doctors. It's not the same for everyone. And so the most important thing that you can ask, besides experience and looking at before and afters, is to be really clear with that person with what your goals are and see if you've got good synergy with them. If you keep saying, hey, this is goal X that I have, and they keep pointing out, let's just say your goal is pigments, and they keep pointing out your wrinkles, your outcomes aren't going to be great because they're not on the same page as you. So make sure that you are completely aligned with your provider. Ask them tough questions, and unfortunately, I think a lot of us have had this experience, especially if you've had other aesthetic treatments. you do have to take a lot of your health issues into your own hands. So you've got to be just really well researched and know what questions to ask the hard questions, and hold them accountable. And if you don't feel comfortable, don't do it, because these are acids, these are lights, these are very, very aggressive treatments going on your face. And burns do happen. You know, I have performed more than 12,000 peels actually I stopped counting at 12,000. And one time I was traveling, and there was a woman who, we weren't vibing very well, but she wanted to be my model, and she was a nurse, and she just didn't disclose that she's using Tazarac, which is a very, I know, there's a very...
a key aspect.
Okay, this is a very, very aggressive...
So what is Tazarac?
It's a very aggressive form of retin-A. It's the most aggressive, and, you know, you cannot peel somebody who's been using Tazarac for at least 7 days, and she didn't tell me that she used it the night before, and I burned her. And that's just something where my gut deep down said, don't treat her. Her gut deep down said, I shouldn't have this treatment, but she really wanted it, and I unfortunately had a job to do, and we did that, and a burn happened. And so I bring this up not to say, hey, I burned somebody, but to tell you that these things do happen. And so that synergy, that trust with your provider is key. And if you don't feel good about it, you have to listen to that.
So that also kind of brings me to another question. What are the things that you should and should not be doing leading up to whether it be a laser or a peel?
Okay, so I'm going to let you...
It's similar in most instances. Definitely, if you're using a retinol or a retinoid, you need to stop it at least 7 days prior. If you, for for laser, if you've been on Accutane, you have to wait a year. If you are on any, like, doxycycline, tetracycline type products, you have to wait, because that is a photosensitive medication, and I'm using a light to treat you, and I can burn you with, just like Nicole was saying, with the Tazarac, it's the same thing with a laser. You know, if you have healing issues with your skin, if you have photosensitive disorders, that's another thing that's really big.
So, like, really letting the provider know all the medications, too, that you're on as well, even over-the-counter herbal stuff.
I mean, sometimes I'm just like, tell me everything. You know, do you use any, you know, acids? What do you use? I mean, another idea is bring in a little bag of what you use, because it would be easier for me to look at it and say, oh yeah, don't use this, than you saying, I had one lady who told me she used some brand of something, and I went on my phone and I'm like, point out which one you use. And she pointed it out, and it had a mild retinol in it.
Yeah.
But still, I'm like, don't use it, because she was like, no, I don't use anything that has retinol in it.
I'm like, palmitator.
Yeah, I'm like, are you sure? And she's like, yeah, I used whatever brand it was. And I'm like, oh, okay, let's look, because of course there's so many brands out there. I can't tell you what's in everything.
Right.
But so we Googled it, and I looked, and I said, do not use it. Oh, really? I'm like, yes, really.
Actually, it's a really good point you bring up. And another case, I've had 3 cases in my lifetime of peels gone wrong. So the second case,
peels gone wrong.
The second case is I was in Brooklyn and doing another peel training, and there was a woman who was a Fitzpatrick. She was not a Fitzpatrick 5. She had a bit of a darker skin type, and she had just traveled overseas to Jamaica. And she came back with this skin cream, and of course we were asking her, please be transparent, what are you using? And her answer was, oh, I'm just using this cream. So we actually asked her to show us the jar, and there was not much on the jar. You could just see, like, a lot of the emollients, like the shea butter and this and that, and I was like, okay, we're probably okay. So we did a 20% glycolic acid peel, very gentle, superficial, and all of a sudden she lost all of the pigment in her face. We freaked out. Her daughter came in and she said, oh my God, Mom, your cream, there was 8% hydroquinone and 1% retinoic acid inside that she had compounded. She didn't know what it was. All she knew is that it was going to help her manage pigment issues on her skin. But her daughter knew. And if we would have known that, we never would have put the acid on her face. So we used a steroid and all her pigment came back and it was fine. But again, if you are not sure what's in the jar and you are going to go under these treatments and pigment is an issue, bring it with you, because we are trained to look at those ingredients and to really know and understand what to do.
Look at what my heart rate is. I'm hearing that. 101. Just.
Oh, trust me, my stomach dropped. Oh my God.
And there's a question about Asian.
Yes, and just so you guys know, I'm trying to write some stuff down on my phone so that I can kind of remember certain things.
I'm like, so again, you know, with the peels, have you done?
Yeah. So with Asian skin, we have to be really careful because
Mm-hmm.
Asian skin appears one way but behaves another. It behaves really sensitively, but it appears like it's very tough. And I have treated Asian women and men with melasma. I've treated Asian skin with acne and post-inflammatory hyperpigmentation. The philosophy goes, and I have been trained this philosophy by some of the most famous peel doctors in the world, low and slow. So if you do have Asian skin, if you have a darker skin type, when you talk to your provider and you have a good consult, tell them low and slow is what you want. So you want a low concentration of acid for a very short amount of time, and you want to test your tolerability. We always recommend a little patch test right back here to see if you're going to have any immediate reaction to the acid in terms of either hypo or hyperpigmentation. And so when I've had success treating Asian skin with melasma, it's been important that I start very slow and give them very minimal treatment. So I might start with a 20% glycolic for 30 seconds on the skin, take it off. Bring them back 10 days later, and same percentage of acid, go for a minute. And build that up until I find the sweet spot, and then we can get into a more aggressive pigment management regimen. But that's a safe way to do it. If you've got somebody who says, oh no, you'll be fine, this acid's been proven safe, I wouldn't recommend going there because you still have to be very careful. These are still acids. They still cause inflammation in skin. That's how they work. And so I would just be really careful with that.
Now, what about Asian skin with lasers?
You know, the laser that I have in my office, you know, I'm obviously limited to what I have, but I did do some research, and I did find a few lasers out there that are good for Asian skin, because I knew that this was one of the questions out there. I just, like I said, just researched it, so not picking one laser over another. It was just the one that I happened to research. It was PicoSure, and it is a laser. Again, I don't have this laser. It's just one that I researched. That a lot of these lasers work on heat, and it damages the skin, so your skin repairs itself. Well, this laser specific, it is not as hot, but it works where your body repairs it itself, and it helps with the fine lines, it helps with acne scarring and pigmentation. And when I was talking to them about it today, the first picture was an Asian face, a before and after, for acne scarring and pigmentation. So, you know what type of skin you have, and do a little research yourself prior to going in. And make sure, again, main thing, that you vibe with your provider, that, you know, a lot of times if I'm with a patient and I'm not sure, I'll research it myself before, and I say, let me call you, because I would rather make sure we are on the same page, and, you know, what they may be asking is something I don't have, like a laser, you know, that is specific for Asian skin. So I will always, you know, kind of look out for them. I give them recommendations and things like that, but make sure you vibe with your provider, and make sure you do your homework before you come and see somebody.
And one of the things that I do want to say about providers too, with kind of knowing where to go, to kind of piggyback on that, word of mouth, you guys. I can't stress that enough. If you know somebody that has been going to an esthetician, a nurse practitioner, dermatologist, whoever, for peels, lasers, anything, you know, talk to them and see, have they been happy with the results? You know, whether it be, hey, don't go to this provider, versus, hey, I've been seeing this person for several years. We've done these things. I've been really happy. You know, I can't stress that enough. So talk to your friends, talk to your family. You know, I recently did a pre-procedure video on YouTube with this. So that's one of the things that I talked about. And then jump on social media. I know Jen has, you know, her page that she shows a lot of before and afters, and I think that that's very telling.
You know, if you're proud of your work, might as well show it. And, you know, I think that social media is, you know, the way of the future. You know,
it is.
It really is. You meet a lot of fun people on social media. We were just talking about that prior to this live.
You know, and specifically Instagram. Instagram is gaining popularity as a platform for providers to share the before and afters, and you really want to check there. And then check the comments underneath too, because a lot of times they'll get questions, and you want to see how they're answering the questions, and this way you get an idea of how they're thinking.
And Beauty Unplugged. Yes, I was reading that too about this PicoSure laser, that because the heat doesn't damage the skin as much as an IP, you know, other lasers, that the downtime is a lot less than a normal laser. So yeah.
So you might need like a series of those.
Yeah, I mean, again, I'm not 100% sure because I've never been trained on this laser. I was just kind of doing my research. But the main thing that I saw repetitively was the downtime was a lot less than a normal laser.
Now, one of the questions that was asked, I am trying to write them down as you guys go, so if we don't answer them right away, we will try to get to them. Broken capillaries.
Those are so much fun. You know, we're in a time of instant gratification. Everybody wants a result right then and there. And broken capillaries are instant gratification. It's actually one of my favorite things to do because I get to chase the vessel. It's so crazy.
She literally says that.
I do.
She's like,
so much fun.
you.
I'm like, oh my gosh, watch. And I do. I love it. I will take pictures during the procedure just to show the patients, hey, look, here's your capillary now and here's your capillary later. You know, and the thing that I tell people is, you know, with the brown spots and things like that, yes, you know, I can treat them and you make sure you wear your sunscreen and, you know, I can't guarantee they'll never come back if, you know, you have sun damage. But the thing with capillaries is we can treat them and IPL does a great job at it. I mean, and that just happens to be the one, again, I just am talking about the ones that I specifically have in my office that I specifically use. I put a little adapter on and I just go to town chasing all these little vessels, and there's other ways to do it where we use the actual full portion of the laser to help with like people with rosacea that have the flushing. You know, it kind of helps do that broaden effect of that redness. But the thing is with the broken capillaries, the way I like to tell people is it's normal wear and tear of the skin. So just because I've treated your broken capillaries, I can't guarantee that, you know, in 6 months, you might want a little refresher. And I tell patients that. They're like, well, how many treatments do you think I'm going to need? And my answer is, you know, it depends. I can get you to a happy place. And then in 4 or 6 months, you know, depending upon your normal wear and tear of your skin, you may want to come back and you may want to do a little spritzer, you know, here or there. And, you know, and I always talk to them, I say prices may vary, you know, because if I'm doing your full face, you know, the first time, and then the second time you come in, you just have some spot around the nose. Again, speak with your provider, but IPL for vessels, it's the best.
So I have a story about that. So Jen has IPL'd me, and I think this was like my second session or something. I had this broken capillary right here inside my nose, and Jen is like, I really want to get this. And I'm like, I mean, granted, you've got, you know, you get numbing cream beforehand and then you wash it off. But it doesn't, you didn't think to put it, you know, up your nose beforehand. And so,
oh my.
Nothing Jen has done to my face has hurt, but I have to tell you, like, I nearly, like, jumped off the table. Well, and that was done with my permission. I mean, I said, yeah, go for it. But
it's definitely uncomfortable. And a lot of the times when I do have patients that specifically are in for capillaries, my girls know that they need to look up the nose because I'm the kind of person that if I see it and I don't like it, you're not going to like it. And most of the people are like, oh, if you don't like it, definitely just do it. Like you. Yeah. Oh, definitely. Yeah, just do it. Go on. But now my people know that if I'm doing specifically capillaries, they're looking around the nose because they know that's my sweet spot.
That's so funny. So my mom actually asked the question of what products can you do post-procedure to help your skin heal faster, whether it be peel or laser?
Okay, so my happy place. So specifically, there's a lot of products that are out there, and a lot of them are tested safe post-procedure. And the most important thing you can do is have something that is barrier repair. So you want to really have a protective barrier on your skin, especially while it's healing, and especially post-laser. Peels aren't always super aggressive. You're not going to get full ablation from chemical peels unless you have a really, really deep one, and that's getting more rare as we're getting more sophisticated with the lighter acids. But there's two things that you need in addition to a good barrier repair cream. One are growth factors, and the reason I say this is because the way that peels work, and even the way that lasers work, they work by putting a controlled injury in skin. So whether you're breaking down the keratin bonds between skin cells, that your skin perceives that as an injury and it jumpstarts the process of making fresh skin cells, making collagen, our favorite thing, and elastin, etc. Lasers do the same thing a bit differently, but you still get this inflammation. But as you get older, and as we age, we're all aging every day, your skin loses efficiency to repair itself and to release a lot of the natural growth factors that cause the really good healing on its own. And so you need a good set of growth factors to really get in there and help your skin rejuvenate. Also, vitamin C. Vitamin C is something that you can't make on your own. We lost the ability to make our vitamin C a long time ago. And whenever you've got inflammation in skin, vitamin C is necessary to cause healing, but because it's so water soluble, there's usually not enough of it available to be utilized right away. So we need a topical vitamin C, then your barrier repair cream, and there's so many out there. Just choose a good one that's benign, doesn't have a lot of active inside, and then of course SPF.
SPF is very important.
Most important.
Anything you wanted to add to that?
No. I liked it.
Thanks.
I liked it. Well said. Bravo.
All right, so I do have some questions that you guys. Oh, will IPL work on any other areas of the body?
Well, are you talking broken capillaries or are you talking brown spots? Brown spots, yes, it can work on other areas of the body. Broken capillaries, maybe some on the chest. I know that if you're thinking superficial little spider veins, no, it will not. But I don't know exactly what you're thinking.
Now, I do have to toot your horn for you.
Toot,
Jen
toot,
has done some pretty amazing chest and hand IPL treatments, especially for sunspots.
Yes,
You can
capillaries.
see them on her Instagram at @Derm, just saying.
Just saying. We're just throwing that out there. That's what you call a plug.
Definitely check her out.
But for the capillaries, actually, interestingly enough, there is a condition called poikiloderma of Savant, which most people are like, what is that? But basically, I love to just kind of dumb it down for me, to explain it easily. It's called it's basically when you see people with the red neck, it's red neck. And it is a combination of brown and red. And basically the people have all these broken capillaries and they have a little white spot here and then they have all these broken capillaries here. And it is a condition. I'm actually working with somebody right now and we have made great improvement. And unfortunately the pictures aren't worth the words that you can see in her because it's on the neck and it's hard to really tell in the picture. But it is a capillary based condition, and so I've been working on her neck capillaries and some of here in the décolleté. But as for if you're thinking legs, no, it won't.
What about laser for large pores?
I mean, no. Again, it's a Fraxel can help. But really,
but shouldn't
it's
that not be your main goal?
Yeah, no, it's not.
You're going to have a boost in collagen, which will...
Yeah, it's going to help it, but...
That shouldn't be your main goal.
Yeah. I mean, if you came to me and asked me to do laser for your large pores, I would probably maybe steer you in another direction because I don't think that you would get out what you want.
What about...
post-inflammatory hyperpigmentation on acne.
Or should you do something else?
I would probably wait for most of my patients that have acne scarring. I make them wait until their acne is controlled. A lot of the acne scarring will fade over time, especially like somebody, as actually all three of us, how fair skinned we are. A lot of our post-inflammatory hyperpigmentation would come more as red and then fade over time. So I normally won't address, and I have many patients that come to me and they're like, I'm ready, and I'm like, no, you're not.
No, you're not.
Because although I could address your red acne scarring right now, it may look better on its own. So I always tell people we need to wait at least 6 months or so before we see where we're truly going to be at to then say, okay, now I think you should do X, Y, and Z.
If it is something that really bothers you in terms of topical skincare, if you add alpha hydroxy acid products into your regimen, so something with think glycolic and lactic acid, just a couple nights a week, that can help lighten the appearance without causing it to get worse. But unfortunately, the PIH is a result of deep inflammation in skin, and unfortunately, it just takes time to pass. So you've got to be good with that, and just sunscreen, and you can use some products to help lighten it. But in terms of having a physical treatment, the worst thing that we can do is make that inflammation worse. So you've got to give it the time it deserves to try and heal itself as much as you can.
And I will post this, Tika Bailey. I see that you do have to go. So I will post this, and I'm going to try to actually save it and maybe post it on YouTube at some point. So
thank you for coming.
Yes.
Yeah, thank you. Bye.
So where did we go? Oh, so we were talking about acne, and I think this is kind of a good segue. Making the most of skin. She's in Australia, so I think she's sleeping right now. But she's said she's had acne since she was a teen. Now she feels like she has it under control, but it's left her with scarring. She's been getting the Dermapen treatments, and she's kind of unsure about whether or not it will be able to address the deeper acne scars that she have. What recommendations?
Well, yes, Amber and I had talked about this, and again, it was one of those things where it's kind of hard to definitely say this is what's going to be the way to do it, because I don't know the person, I've never seen the person, and again, it's really, you got to see the person, you have to talk to the person, but I know it was more on, Amber and I were talking about, I would at least try and do 5-6 of the micro needling, Dermapen, whatever they call it, and then kind of see from there if she's getting the results that she wants. If it's deeper pitted acne scarring, you can try and do a little bit of that Dermapen, or not what you call it, they call that. But, Fraxel is another way to help with the pitted acne scarring. And so it would kind of be, again, coming at it with different modalities and, seeing what the end term result is. I mean, some people have the acne scarring that, I just told somebody recently, I'm not going to have you smooth, but I can at least get you 50% better.
Absolutely.
Mm-hmm. Now, should you wait a period of time to kind of see how your skin looks?
Yeah. I mean, in between treatments, I would definitely say wait a month. But, and if she's doing 5 or 6 treatments, I would wait that 5 or, do those 5 or 6 treatments and then wait a month or 2, see where you're at, and then kind of go from there. Because, I mean, you have to also go into it with realistic expectations. If you have very deep-seated acne, again, you're not going to be smooth, but you will have improvement. So it's all about what you look like today and what your realistic expectation is going to be. And again, you got to make sure you're working with somebody that's honest with you and is going to say, like I tell people, I will one lately, I'm not going to get you smooth, but I will make you at least 50% better. Absolutely. And if she, was happy with 50%, because if you have acne scarring so severe, shoot, if I said 10%, you'll be happy with 10, right.
And I think it's also important to make sure that you get a patient or a client on a good home regimen where you've got the acne under control and, kind of taking a look at acne, broad as causes and, PCOS, things like that.
And if you're going to spend all that money at an office to do Dermapen or laser or whatever, you're not going to get your full maximum achievement of whatever you want, whatever your end term goal is, if you're not doing it at home too.
Right.
It takes a whole army to get you where you want to be. And if, you only have half of the brigade, then,
It's true. And even afterwards, you think about what the Dermapen is doing in your skin and what caused the scar, it's really a depression in the collagen that, used to build the skin up, and when you have the pitting scar, there's just not a lot of collagen left. So you want to think about adding in good vitamin A, or like retinol, palmitate, retin A, whatever you're comfortable with. Growth factors, vitamin C, all the things that stimulate collagen production so that when you have these treatments really fixing your skin, you can maximize that. And you will start to see really, really good improvements, and it will maintain it for the long term.
And one of the questions that I am still trying to write them down that was asked is what should you avoid? I know it's kind of treatment specific based on the particular peel or the particular laser. What should you be avoiding post-procedure?
Post-procedure. So anything that basically does anything.
So everything.
Any alpha hydroxy acids, retinol, anything that's, very aggressive and is not part of the healing process, I would avoid until your skin heals from the treatment, and then you can add everything back in.
What are your thoughts on the post-procedure kits? I know Zoe Skin has it, Cosmetic has.
I mean, a lot of these post-procedure kits, I think they're great because I believe some of them have vitamin C, but they have epidermal repair creams, and that is, I personally have done these types of ablative type procedures where I've used over-the-counter stuff and I've used the epidermal repair creams, and the differences are amazing. And I will say another little fun fact. I like to put my stuff in the fridge. So when you put it on, not only does it repair and soothe, it's that's the only way I can describe it, is But, that's another little fun fact. But I think that they are worth the money because although you're like, it's just a cream, but it's actually specified to repair the damage that you just paid to have done.
Mm-hmm.
And I can tell my healing time, I sometimes feel, is even faster just because I'm putting on something that is specific to heal my skin, not something that's just water-based that is just there to help.
Mm-hmm. I completely agree with that. I mean, I think to have post-procedure kits are designed and usually tested to be used post-procedure, and likely, especially medical brands, they won't be able to launch without having passed safety testing, clinical testing, things like that. So just pick a brand you like and whatever your provider really recommends. And
that's what I was going to stress, because, your provider, they're going to have experience with multiple patients with that procedure, with the success of those products, and I don't know, that just feels safe. I think it's a Skinmedica.
Serum with growth factor?
It is.
Yeah.
Oh, okay.
Yeah, it is. Skinmedica TNS serum does have a lot of growth factors inside, and right now, that is really the standard that's on the market. There are a few that are coming, hint, hint, and actually I'm helping to launch one of them, which you'll see pretty soon. That might be a bit more robust, but TNS does work, and it's worth the money, but I would definitely look at investing in it when you're investing in it to be utilized with your procedures to help you get through that process.
Yep. And after the microneedling, I used the Skinmedica, the TNS Ceramide Treatment Cream, and I love it. It's going to be in my January favorites, so bit of a sneak peek.
Awesome.
Looking into large pores in general, would say. Salicylic acid, niacinamide.
Definitely. Salicylic acid peels for sure at minimum. You can use alpha hydroxy products every other night. Niacinamide always looks good. If you're not averse to using retinol, I'd add in retinol. All those things over time can help your appearance of your pores be a lot better.
And then I think also, not just the adding things, but removing things. So, just being really diligent about your SPF and anything that's going to break your collagen down.
Definitely. Avoid.
So there's a question about LED therapy. Thoughts?
I'm not, to be honest. I don't know much about it. I apologize for that, but LED is something I've just never taken the time to really get to know, and so I don't want to answer it and sound ridiculous. So maybe we can do some research and come back to you on that.
Yeah, I'll make sure Amber tells me who it is, and I can always message you if you want. I'll look into it.
I have a handheld home device. I mean, there's going to be different LED, what you can get in an esthetician's office or doctor's office versus what you can have at home. I have a Skin Clinical one that I like using. I don't use it probably enough. I should probably use it a little bit more. But for me, I feel like with my skin, it kind of helps me decrease inflammation. So, what other questions do we have? SPF ingredients that sting the eyes. I think that's mainly your chemical ones, right?
Yeah, the chemical filters. So be vigilant with your sunscreen use. You need to use it every day, and using it is more important than not using it. So whatever sunscreen you have, just use. But you've got chemical filters and physical filters. Mm-hmm. Chemical filters are really good if you're outside running a marathon and you're sweating and you need a thinner texture. Mm-hmm. They're good for that short-term use, but for your long-term daily use, you should really consider the physical filters because they usually don't get in your eyes and they give you more broad-spectrum protection.
And a lot of the physical SPFs now are tinted, so the white cast that you've had before.
Yeah. Exactly, and they're also micronized, so the textures are a lot nicer. And when you look at the long-term clinical testing of some of these things, you're starting to kind of see just little buzz, and you can look it up online and see, but there's little buzz coming out about the chemical filters, just saying, just how much more we're going to start to get away from using those and more into the physical filters. So if you're using it every day like we should be, definitely look at the physical filters. In your sunscreen, SkinCeuticals makes great ones, Zio makes a good one. Almost everybody has a fantastic one, so pick a texture and a price point that you like and just use it.
Yeah, some advice that Caroline Hirons posted on a blog or did a video on that I know that probably a bunch of you guys watching have heard is find an SPF that you like. Texture, how it feels on the skin, if you wear makeup, how makeup layers over that. Find the one that you like because that's the one you'll use. Mm-hmm. If you have a product that you don't like, you're not going to use it. And it's not going to benefit you by having it in your drawer, and you're not going to be protected. No. Thoughts on the home microneedling?
I actually had somebody message me about this recently too. With the home microneedling pens, the roller pen things, I don't know, I mean, and there's so many different ones out there. That's my other problem. They're like, well, I do this microneedling at home. I'm like, okay, well, you know, how deep does it truly go? You know, again, it's going to be kind of back onto Nicole's home peels. I know that these home microneedling pens are going to have somewhat of a safety net because you can't go as deep as you could in a medical professional's office because we know the settings that are safe to go in the specific areas, you know.
But couldn't you also overdo it though? Because, I mean, you have one pen that's got one length of needles.
Yeah.
And, like, you could be going in around your eye.
Well, yeah, and, you know, like the texture here, you know, where it's on the cheekbone or the forehead or the jawbone, those are all different settings than the cheek, than the neck, than, you know, the under the eyes. You know, when I'm doing microneedling in my office, I have 4 or 5 different settings that, you know, I'm specifically changing here and here and here. Every little area has a different depth, and I have a setting for each area. You can, you know, I want to go between this and this, you know, this is really aggressive, this isn't, you know, and I think with just going home, and even if it's just a little bit of a difference, you know, I think that I think that the home things have that safety net. I think that it might take multiple treatments. And again, it's going to be making sure you're using the products with it.
Yes.
Because if you're just rolling your face and you're not doing anything else, you're probably not going to see the results, and you're going to think you're wasting your money.
In the cleanliness factor,
that's
really
the other thing. That's
important.
the other thing.
Actually, I have a ruler if you want me to grab it to show, but basically these needles are so tiny.
Yeah.
And at home, you don't usually have access to the equipment that you might have in a medical office to sterilize, or there's an autoclave, UV light, anything like that. So if you're just cleaning it with alcohol, unfortunately, alcohol is not the best thing to clean off all of the microbes and the pathogens that can accumulate on these needles. And with consecutive use of that, it actually becomes very dangerous. I've seen infections happen from these rollers. And so my best advice to you is that if you're a person who, I've used derma rollers, they work fantastic. They're really amazing if you combine those with growth factors, but you need a fresh one every time.
Yes.
And you have to be really good. And actually, I don't condone using them. I use them as practice as like a product evaluation, but I don't use them daily because it's really hard to be consistent in the pressure. So if you go too deep, you actually can permanently scar yourself. If you don't go deep enough, you're wasting your time. And, it's better to trust the professional with that. But if you are going to do it, try to find some that are cost-effective enough that you can use a fresh one every time.
Very good.
Yeah.
Good question. Growth factors. What specifically are they?
Oh, man, I could talk to you for days about this. Growth factors, to kind of keep it simple, they're proteins. They're peptides that are found naturally in your body. And the ones that we typically refer to in skincare are ones that come from a nascent or a very young source. So, for example, TNS, essential serum.
Let's. Do you guys know where that comes from?
Do you know? Okay, so
sit down.
TNS.
Do you know where their growth factors?
Okay, so they come from baby foreskin.
Baby foreskin.
They came.
That's been discarded. Like.
Yeah.
You don't want it anymore.
So basically what happened is that there was a circumcision, and within the tissue of the circumcision, they found stem cells. So they took these, and actually it wasn't even a stem cell, it was a fibroblast. So they took these human fibroblasts out of the tissue and cultured these fibroblasts. In the fibroblasts, yeah, me too, I'm laughing. I think on the ingredients it's called human fibroblast conditioned media. Yes, and that's exactly what happened. So they basically take these fibroblasts, put them in a petri dish, put some media inside, and they release all of these amazing proteins and peptides and cytokines. I know.
We're getting some fun emojis.
They release all these things into the media, and they pull off the media to leave the cells behind, but basically because it's coming from baby, all of these peptides act as messengers, and they tell your skin to do certain things. So the theory goes with TNS, you put it on topically to your skin, it will jumpstart your fibroblasts to make more collagen. It will jumpstart your fibroblasts to make more naturally occurring hyaluronic acid. So growth factors are really good. Now, there's different sources. What does it say? So that time that one hit my cheek was good, right? Oh my gosh. Dying. Okay. You guys are hilarious. You just maybe totally lose my train of thought. Okay. But
I don't even remember what you're talking about at this point.
Different sources of growth factors. You've got the human fibroblast. There's one coming out now that you'll see me talking about that's very important to us. It's coming actually from the umbilical cord lining. That you'll have a mixture of epithelial and mesenchymal cells. And I know that's really scientific talk for basically more types of proteins that can reverse the aging in your skin. And, some people use plants, but plants aren't always recognized by human cells. And so there's different sources, but basically what they do is they mimic the function of your cell when you're born. So if you have good quality growth factor and you have a way to get it in skin, which is why we say use a roller, use needles, use laser, use peels, then you really, really will have a good result using those just to really turn back the clock, and your cells will start to behave young. Like, I've seen it happen. It's really amazing. So growth factors are good.
And then the human-derived ones, sometimes with the microneedling, you will see the platelet-rich plasma. So it's your own growth factors, and then they spin it down, use the plasma either topically or they'll kind of inject here or there. Yeah. But you mentioned something really interesting is that, let's say that you're 40 and you go and you have microneedling done with the PRP, those are 40-year-old stem cells.
Yes.
Baby.
Yes, you want the baby ones.
You want the baby.
Amber brings up a really good point.
Which is something that I hadn't considered until we talked after the live that we did before.
And I didn't know until now that I am working with a company to bring these amazing source of stem cells to awareness to the public. But basically PRP, if you're not aware of it, it's platelet-rich plasma. Like Amber just mentioned, you draw blood, you spin down your plasma, and they pull the growth factors from platelets out. And the theory is these are your own growth factors, and so your body will recognize them, and you have just opened the skin, and so you can really deeply penetrate what those growth factors are. But if you are, let's just say, 40 years old, like you just said, if you're 40 years old, your cells are very likely around 40 years old. So the amount of growth factors that a 40-year-old cell is going to actually secrete is very different than the amount of growth factors that a 5-year-old or a 2-year-old or a 6-month-old baby or even an unborn infant is going to secrete. So the amount of growth factors that you need to pull from somebody who is 40 years old or higher is so much that it's actually not realistic that you're going to get as much of that coming out of a PRP treatment. So it's just something where PRP is great, it does work, but you may want to consider incorporating a different source of growth factor to really accelerate that, because again, you are going to get fantastic results from that.
And I can add, I used I didn't do PRP for my microneedling, but I did do the stem cell from the baby. And so,
the umbilical line.
Yes, for the baby's stem cell.
The product that Nicole's been working
yes,
with.
I don't know really how to, so I used the baby because they're talking
Karen,
about,
I will save this.
They're talking about 40-year-olds, and I just turned 40, so my stem cells, I want to look like a baby, so I would much rather take the baby than my 40-year-old stem cell. Yeah. So I did do that just last night, actually.
Which, I mean, even though you have makeup on,
I did put a little makeup on today.
You really don't have that much on. I mean, I can see your skin, and she sent us pictures, which I'm not going to show, like of how you looked after the treatment. I mean, you were red. This is my second one that I've done, and the first one I did, it was aggressive, but last night it was really aggressive, and I figured, especially because I was using the baby stem cells, that, I really wanted to get them in me. So, I was really aggressive last night, and I sent my husband the pictures. See,
he was like,
"You don't look 40."
Oh, yeah. But I know but my husband last night, when I sent him the pictures, he's like, they were out, and he goes, "Yeah, don't come out."
They were actually really scary. I'm not gonna lie. I've seen pretty bad. They were pretty bad. But today, you would never even know.
No.
Yeah, I mean, I'm a little red here, and and I didn't put much makeup on just because I always feel like post-treatment, I hate to even put makeup on, but, mineral-based makeup is always okay if you have to, like me today. Put a little something on. You want to use something that's mineral-based, obviously, something that's not going to clog your pores, but I just put a little bit of foundation on, and, underneath it, though, I mean, even my husband, when he saw me today, he's like, "Oh yeah, you look much better." And he said, "I just look." His wording was, "I look really rosy."
It's because you're so happy.
And I'm like, "Okay, thanks." So I figured the pink shirt would match my rosy face.
You're gorgeous.
Oh,
Yes.
thanks.
So one of the questions that was asked is, what can you do for under eye wrinkles?
Actually, microneedling is really nice because with the microneedling, you can get, and that's, I
was really surprised when you did me. Yeah. I'm like, we're going there? We're going there?
Yeah.
Is that okay?
I mean, it's really how much a person can tolerate. And again, it's setting specific.
Right.
That's very, very fragile skin. So you don't want to go the same depth that you would do your cheek here under your eyes. So with microneedling, what I really, really like is that you can really go all the way, I mean, as much as people can tolerate, all the way up to the eye and have the same effect that you would have all over. And with laser, when I'm doing laser, I can go up to the, the bony orbital rim, where you feel that bony prominence there. I can go up to there and I can pull down a little, but you're not going to get, for people that have that the wrinkling right underneath the skin, I'm not going to be able to get that skin there. So, I think microneedling is really nice because I can get that area.
Mm-hmm. Awesome. Well, I know that we are kind of running short on time. Can you believe almost an hour has gone by?
I can't believe it.
I know. So let us know if you guys would like to see this again, what topics that you want us to cover. I think we tried to get to most of the questions, but if you guys are game,
always,
we can do this again.
Anytime.
So I will try to, I'm going to save this, and then I will try to download it and then upload it to YouTube. So why don't you guys let us know where we can find you?
Okay, so you guys can follow me at Aesthetics Expert. I'm pretty sure we'll have it in the comments, but it's A-E, can I spell it? A-E-S-T-H-E-T-I-C-S Expert on Instagram. That's where you find me. I don't always do a ton of product reviews and things like that, but I think I definitely will start because I get a lot of these questions too. And I've been around so long, I think it's fair to share the info. So I think I'll do that. And so you can find me there, and if you are in medical aesthetics, you can also follow us at Aesthetic Influencer, but that's another conversation for another day.
And then you can find me at Derm NP, and I know Amber had asked me a couple laser questions as well that were in her comments, so I'll go through the comments from the picture that she had of the three of us, and if there's specific questions that I know we didn't address, I can either try and address them there in the comments, or I may just message you with some of the answers to some of the questions. And you guys always feel free. I love what I do. It's easy for me to talk about. I just met somebody again yesterday on Instagram that, I said to her, anytime, just ask me. And she's been messaging me back and forth about specific things because she unfortunately doesn't live in Florida. So,
she can get on a plane though.
Well, I told her that. It's crazy. But, I'm always happy to help. But I'm at Derm NP.
Yeah. And Jen and Amber are both incredibly responsive when it comes to questions and things like that. And so if you do have questions, don't hesitate. I know how frustrating it can be to find a good provider and to find somebody who you really trust, or even to know and understand what questions to ask. And so I would definitely recommend to reach out to these ladies because they're phenomenal.
Oh,
thank you.
Treating your mother's skin. Next topic.
Bring it on. Come to my house. Come to my house. We'll take care of you.
All right, guys. Well, thank you so much for joining us either live or if you're watching this that we've saved. Really appreciate it. And again, send me a message on what topic that you guys would like us to do next, even if it's just answering frequently asked questions. Yeah. But we will see you guys all very, very soon.
Bye.
Bye, guys. Bye.